All right, it's that time of year to renew your Medicare coverage. Open enrollment begins October 15th, runs all the way through December 7th. Now, that's 7 weeks to think about your health care needs for the next year and decide whether or not you need to make any changes in your coverage. Joining me now to talk more about this is John Hill of Gateway Retirement. John, always good to chat with you. Let's get right into this. So,
yes, sir.
What can Medicare recipients expect this year? Any big changes coming their way?
Oh, yes, there's a few changes, and people need to not assume that plans always stay the same. There's going to be some changes. I've had quite a few calls here at the office. Some people know their drug plan cost is doubling. The deductible is going up from $445 to $480. Assuming it's the worst thing they can do because things can happen and you not be happy about it. So they need to go like to Medicare.gov and check these things out for themselves. So they give us a call and we'll give them directions. There's a lot of things. Also, build networks change. Some doctors will be in network and next year they're not going to be. So that could really affect people not being able to see their doctor without a much higher price.
Is there any way to manage some of these costs when some things go up, or do you just have to kind of readjust your own budget based on your needs?
Not necessarily rearrange your budget or readjust your budget. There are things. Recently, and this is very recent, I had a client tell me they couldn't afford a medicine. I said, what medicine is it? We looked online, found out their network was. Out of network, their medicine was $180. In network, the price was $11. And being in network, before you buy a new Medicare Advantage or drug plan, you need to make sure what your network is because it's very harsh this year. Being out of network, you could pay 10 times more, literally.
Have there been any significant changes to the actual premium that people are going to pay?
Yes, sir. There can be. If you have a Medicare Supplement, or what they might call Medigap, it goes up every year. You need to be aware of that. There are 36 companies who sell Medicare Supplements, and they creep up every year, and you don't have to stay there. They're standardized. So if you get a Plan G with one company, Plan G with another company is the exact same coverage. It's kind of like buying gas. It may be higher in one place and lower in another, and it's still the same gas. And Medicare Advantage, like I said, they may even change what's called the tiers in the drug program. And you're paying $4 now, you might be $47 next year. So when I say don't assume, it's very important that they not assume, but they look into this and actually investigate so they can keep their costs down for their needs.
So if you're already on Medicare, you probably know a lot of this information, but maybe if you're in your early 60s or maybe even your late 50s, I know you're not Medicare eligible until 65, unless there are
Right.
some other circumstances involved. But when should people begin to investigate this so that they're not caught off guard?
Well, if they're just coming into Medicare, they need to understand there's two systems, Medicare Advantage and Medicare Supplement. You can't have both at the same time, and you need to be able to pick out according to your health needs. We need to know their medicines and their health history and so forth. And when you're turning 65 or just getting Part B, you can get a Medicare Supplement without any health questions. You can always get Medicare Advantage without health questions, unless you're on dialysis, of course. But you should get a good idea.
All right, John Hill, we appreciate your time. I always enjoy talking about these kind of financial issues with you because they're very important and they're not anything that really can be ignored. So it's good information. Thank you.
Bill, enjoyed talking to you. Thank you, sir.
You bet.